You're listening to The Q Switch with your host, Spence.
Welcome, one and all, to the Q Switch Conversations podcast. I'm your host, Spence, and the mission of this show is to tackle subjects currently impacting ophthalmology, where we invite the innovators, thought leaders, and forward thinkers shaping the field of ophthalmology to get their unique perspectives. So let's jump right in. My guest on today's episode of the Q Switch, titled Timeless Vision Beyond the Microscope, has spent a lifetime restoring vision to others, only to discover that her greatest lesson about vision had nothing to do with eyesight at all. It had everything to do with purpose, reinvention, and learning to see what's possible when life forces you to chart a new path forward. Dr. Durga Larkin is a board-certified ophthalmologist, cataract refractive surgeon, former president of Rhode Island Society of Eye Physicians and Surgeons, clinical assistant professor at Brown University, and author of Timeless Vision, Empowered Aging Redefined. She's been practicing ophthalmology since 1991 and has witnessed and helped shape more than 3 decades of innovation in eye care. Dr. Durga, thanks for making time for the Q Switch, and welcome to the show.
Thank you. Thank you for having me.
So let's get started here, Dr. Durga. Every ophthalmologist has a story about the moment medicine stopped being an interest and became a calling. What was it about medicine, and specifically ophthalmology, that captured your imagination and ultimately shaped the course of your life?
Well, I've always enjoyed helping people, and I actually thought I was going to become, and I talk about this in my book, I thought I was going to become a psychiatrist because I love interacting with people. I like thinking about their lives and how their lives unfold. So that's what I thought I was going to do. However, when I actually got immersed in my training for psychiatry, I realized that I felt like many times I was not able to accomplish what I had set out to in terms of healing, and I wasn't able to separate myself from the difficulties or the struggles that people were having. And I realized I probably wasn't cut out for it. I was just not able to sort of set the appropriate boundaries emotionally, because I just got too involved in their own struggles. So I got introduced to ophthalmology as a medical student. And what was so amazing about it for me was, one, it was fascinating. And two, you could really help people and make a huge difference in their lives with the good care. And with cataract surgery, you're just literally changing their lives and bringing, vision into their lives. So it was very satisfying. I was really helping people. And it was something that was maybe more concrete in terms of being able to be helpful and see the result of it.
Mm-hmm.
Yeah.
Once you found ophthalmology, the specialty itself was evolving rapidly. You began your career in the early 1990s, which means you've practiced through some of the most transformative decades in ophthalmic history. When you look back on your first years in practice, what was cataract surgery like then, and what has changed the most?
Well, I really, like you said, I have lived through a lot of change, and I was originally trained in the older style, which was the extracapsular cataract extraction, and it was just phacoemulsification was just coming in, being started to sort of make its way into actual use out in the public with ophthalmologists. And it was actually just even starting in academic centers. It was new. It was just being taught to us. And there were a lot of ophthalmologists that actually had been in practice. It was such a dramatic change in technique that many of those physicians who were of a certain age decided they just weren't going to make the transition from extracap to phaco, because it was such a different technology. And to start learning a technology like that at 50 or 60 was too much for a number of people. So there were a lot of people who actually left the field or just became general, medical ophthalmology at that time when that big transition happened. And it was a bit stressful starting out, because really most of my training had been in extracap, and yet now the phacoemulsification was becoming standard of care. So when I first came out, I was less experienced in the phaco. And so there was a little bit of an aspect of learning, in the field, and I had learned it, but I hadn't really had those years of sort of repetitive experience in my training. So, but it quickly became apparent that it was, a much better procedure. And and then that was a huge enhancement from being able to just sort of physically take out a cataract and put a random implant in and then give them glasses to perfect their vision. And all of a sudden, we could be much more precise in what we did. And then that evolved through the years where the incisions got smaller and smaller. We didn't have to use sutures anymore. The lenses, we started folding the implants. And again, smaller and smaller incisions. So the precision of what we could do just got better and better through the years. And then, of course, now we have the femto laser, and there are still a lot of people who don't use the femto or they haven't transitioned yet. And part of it has to do with, again, what stage of life you're in a career as an ophthalmologist, and also personality. I mean, I'm an older ophthalmologist. I'm 65, I'm going to be 66. But I like to be more on the cutting edge. I wouldn't say that I jump in immediately, and I'm not one of those people who first tries things. I wait till some people have done it and we make sure that it's a good thing to do. But
Right.
once it's defined that, yeah, this is good, then I jump in on it. And so that's been that is that next step. It's not as big as the transition from extra cap to phaco, but it is a nice step in terms of precision.
Cataract surgery has become one of the most successful procedures in all of medicine, yet every patient is different. How do you balance the technical science of surgery with the human side of helping someone regain vision and independence?
Well, that's a great question. I love it because that balance was something that I really committed to, and I am committed to really addressing because as surgeons, many surgeons, it's really all about the surgical skill. And people do, first of all, eyes is like any part of the body. I always think of eyes as having themselves even little personalities. And I talk to patients all the time. You could do exactly the same procedure and it's different on different people. Their tissues respond differently. And yes, it's overall the same. But, you have some people whose tissues are floppy or flexible or fragile or brittle. And so it changes how you address that surgery. And it's in cataract surgery where it's the most noticeable, dramatic, but even things like I notice all the time when I'm doing, YAG capsulotomies, how the capsule has a different character. And I always talk to patients about the personality of their capsule, how it responds to the laser light. And it's fascinating to me. And then on top of it, you have the personality of the patient. So that actually has, I like to think that one of the things that sets me apart with my interest in human, beings and our the way we think about things is, and that's how, I got started with writing the book, is that I'm not saying all surgeons, but a lot of surgeons, they don't really think about that. They're just thinking about the precision of what is the procedure. But one of the things that also I had a lot of interest in was what's the personality of the patient. And because how they feel about things and how they perceive life influences how they perceive the results of their surgery. So, and a great example that everybody can relate to, and in fact, I had an ophthalmologist tell me I mentioned this in the book, and he said he loved this section because it's something that we all know about. You could have a patient who, their best vision may be after surgery because of whatever reason, their cornea or their retina, they're 20/40, and they are so thrilled. They are so happy. It is the best vision they've ever had. They can do everything. They don't need glasses, and they are like perfect. And then you'll have someone who's a really pristine 20/20, and they feel like they don't see well. It's still blurry. It's like they're just like, it's not any better than after surgery. And meanwhile, they'll have been like, 20/60 before surgery, and now they're 20/20. And you're like, what? So a lot of that is personality. It's not all personality. It has something, there's wiring in our brain that somehow influences how we perceive vision for sure. But absolutely there's a personality or a human component that comes into that. And I was really aware of that. And one of the things I used to love to do, and again, this is just my personal interest, is when I would be counseling patients beforehand, one of my really big things was trying to get a handle on what's their personality. And interestingly, I would have all the major companies of various lens implants and the femto machine we had, they came to me and have their managers come to me, and PR managers literally fly up from other states and come observe me while I talk to patients, because they wanted to know, how is it that whatever you want, that patient wants it as well, like they want it for themselves. And it's not about forcing it on them. It's about really truly evaluating what you feel is best for them, because certain personalities, we know it, are not good candidates for a multifocal lens, or they are not good candidates for a monofocal, or they're not good candidates for monovision, or whatever it is. But to sort of, and then also identify things about them that would maybe make them be that type of person that is going to be 20/20 but not be happy. So taking those few minutes beforehand and just getting a little sense of who they are, I think has contributed a lot to my success. And just for me personally, it's also just something I really enjoy, to try to match what needs to be done with who they are.
Is that where the term, I think so, 20 happy comes into play?
20 happy.
20 happy,
yes.
yeah, 20.
Yes.
A good explanation of the 20 happy.
It's all about 20 happy, because if someone's 20/40, they maybe have some residual astigmatism, but they're like, wow, it's great. You don't need to say, oh, there is still a little bit of a cylinder there. They're happy. It's okay. And it's really, that's the way it is with a lot of things in life, actually, is like, it may be imperfect, but my other big point that I try to make to people is that we as humans, we are imperfect. So you can do a perfect surgery. Everything can go perfectly. And then I have a personal experience actually from that. Is I had a cataract in this side. It was kind of on the early side, but I was just having a lot of glare, had it done. The person who did it, perfect job. Everything went perfectly. I looked at the measurements. Everything was correct. And day one, I was like, wow, this is great. But then it settled in a little bit myopic. And I was like, okay, perfect surgery, everything done perfectly. My eye is healthy. It settled in a little bit myopic, like a -1, and I see 20/20 at intermediate. So it's not actually what I wanted. But the other interesting thing about that is that I used that if I ever talked to patients, if they had a little refractive shift afterwards, or a little refractive miss, if you will, because some people, all it takes is 0.5 refractive miss, and they're like, okay, I want it. They want to exchange the lens, just
Right.
has such expectations of perfection. So for me to go through that experience and make a decision like, I'm not touching that lens. I'm not having LASIK to correct it. I'm not doing anything. I'm just going to enjoy my 20/20 intermediate vision. And that's what I've done. So when I discuss that with people, they're like, oh, okay, yeah. I'm like, wow, I can see all of this around me here, and I don't need reading glasses for intermediate, and I see the dashboard of the car. So that, my own personal experience from that perspective has really helped me counsel people. And but I also realized, if I were a cranky, negative kind of person, or if I just had a different attitude about it, I could feel like disappointed, or like this, or because it was a little disappointment when I saw so perfect right afterwards, and then it shifted, and yet I knew everything had been done perfectly.
One of the themes that consistently appears throughout your career is a deep commitment to patient care. What does an exceptional patient experience look like through your eyes, and how has your philosophy evolved over the years?
Well, I do think that my philosophy actually hasn't even evolved that much. I mean, I do think that as a person, I kind of always have been interested in patient care. And this was even before I was, when I started in medical school, but even in college. And I'm not sure exactly where that evolved from, but it also was people and animals. I love animals too, and I always want to care for animals.
Me too.
I was so allergic to a lot of animals, unfortunately, like fur and dander, that I said, all right, well, being a veterinarian is out. I'm going to
It's
be
not an option.
medicine. So yeah. So, but there, I just find such satisfaction from sort of getting feedback from people and finding a way to help them. So when people come in and even, it's like, okay, how can we make this better for you? Because a lot of people are looking for perfection, particularly these days. But once they understand, like I said, one of my refrains that's been very helpful for me, and I think is helpful for people, is that we are imperfect as human beings. And when people realize that, it's like they expect perfection or immediacy. These days everything's immediate, and sometimes your body takes a little time to heal. And once people can hear that and say, oh, okay, then it opens the door for me to help them or help them maybe look at their situation in a different way. And granted, part of the problem, of course, it's not a problem. It's wonderful that so much cataract surgery is immediate. Immediately they see better and immediately they feel better. And it's a dramatic immediate result for a lot of, the majority. But then what makes it hard is if someone doesn't have that immediate result, or they maybe take a little longer to heal, or they get a little corneal macular edema, or they have a situation that's different than somebody else's, that their husband or their neighbor had surgery and they were immediately better. So I kind of take it upon myself to sort of help them through that, and say, listen, I'll stick with you till you're feeling great, because you are going to feel great. It just may take you a little bit longer. Everybody heals differently, and some of us take a little longer to heal than others. And it's just the way it is.
So I think what you're speaking to is pretty much having a very open and honest conversation and setting the right expectations. Like you said, a lot of folks come in, they may have pathology and expect to get like a panoptics or, some great lens are going to see the future.
All the time. Yeah.
And it's just like, you know what, you actually have this or that, and this is what we can achieve. This is best case scenario. And that way you kind of really align with the patient.
So when they come in, that's a huge thing that I do. One is actually, one of the first things I ask is what kind of work do they do, or what did they do, and what do they like to do? And it doesn't have to be a lengthy, because a lot of people say, well, I don't have time for that. But it doesn't take a long time, and it sort of gives me a little bit of a glimmer of where they're coming from. Now, not 100%, of course, but between how did they spend many years of their life, and then what do they like to do now? Those are just little quick insights that just help me. How you're going to approach an engineer might be different from someone who did gardening, or just different interests and where their mind was and how they think about things. And it just gives me one little piece of information, but I am very, very strict about not putting lenses in that would not be good for that person. So like not using a multifocal on most pathology, to be honest. And the other thing I find is that no matter how much you explain to people about the limitations of, say, the big one would be the multifocal lens, there's still this expectation of, I'm spending this money for this extra lens and I want perfection. Right. And you can, so the other thing I do is, particularly if people one is I wouldn't put that lens in a number of people. I'm really thoughtful about who I put it in. But the other thing I do is I have in my office, some photos of normal maculas, normal corneas, so that if someone has something with their macula, I can say, this is you, and this is, what it should like. And so then one of the things that I learned is a visual, like they're hearing you, but there's so much going on that a lot of what you say is kind of, just blowing past them. So besides having maybe a family member or a friend or a spouse in the room to second set of ears, my big thing is also having visuals for them. And I would show them a very quick video. Less than 3 minutes. And yet it was like really helpful, because people have difficulty understanding the anatomy, even of the eye. They don't really know what a cataract is. They think it's a covering, so just having people get a little bit educated, just a little bit of time, taking that little bit of extra time to, one, find out who they are, two is educate them, three is, and that helps them explain. My other big thing, and I do this a lot in my book as well, is I love analogies and metaphors because people have so much difficulty understanding the eye and how it functions, that it's so different than the rest of the body. So they need ways to conceptualize what you're saying. That's always really important.
The commitment to patients eventually led to leadership roles far beyond the exam room. You've served as president and vice president of the Rhode Island Society of Eye Physicians and Surgeons and held academic leadership positions as well. What did leadership teach you that clinical practice alone could not?
Well, with the leadership, a lot of it comes down to where the needs are. So academic mentorship is different, where you're training the younger doctors and you are trying to also instill, for me, some of those things I just talked to you about like really trying to get a little handle on who the patient is and what do they really need, which may be different than what they think they need. And of course, imparting the skills. So that's more like a clinical thing that you might expect. But the leadership in terms of like Rhode Island Physicians, Society of Eye Physicians and Surgeons is a lot of that actually has to do with all the, all the things that are going on with the healthcare system and with, insurances and Medicare and
private equity.
And I found that at a certain point, if I'm really honest with it, I was starting to feel in certain ways I'm hitting my head against a brick wall. And, we would go and talk with, various legislators and went to Washington, D.C. and people, a lot of the legislators and a lot of the politicians, they were sympathetic. It's not that they didn't want to hear it, but they felt like my hands are tied. And you're up against these systems that are very powerful, very ingrained, have different agendas than we have. Like everybody likes to talk about the ultimate is patient care, but we all know that with private equity and insurances, it's not about like the person or what may be best for them. It's all about the numbers and, it's a different priority. So, and that's just the reality of medical care in the United States. And it is. So so that's the thing, but you need people to sort of still stand up for. You also want to make it so that your physicians can take care of your patients. So you don't want to be putting up all these firewalls that make it difficult to take care of someone, which has happened, or set up systems that make it difficult for you to give the care and for the patients to get the care. And so that's really what the leadership was mostly about.
You've influenced countless students, residents, young ophthalmologists, and colleagues throughout your career. When you think about your legacy within ophthalmology, what do you hope those you've mentored carry forward?
Well, I feel I feel like there's a lot of great teachers out there, a lot of, ophthalmologists out there teaching skills. I also feel that, and there's also a lot of, advocates for ophthalmology care. But what I feel that I bring that's different or that is they don't get from anywhere is that other side about understanding the patient. And that's why these companies, Alcon and Bausch and Lomb, and they're sending people to come meet with me and spend the day with me or come to the operating room with me because they want to hear, okay, what is it that she's doing different? Everybody loves the way she handles a certain thing. So that's what I'm trying to pass along, is that there's more to it. And a lot of people feel like, oh, I don't have the time, my schedule's too busy. And I understand that. And but it's sort of a skill. Like for me, that's kind of who I am and I love that, but it's not everybody's natural personality. And particularly a lot of surgeons have more, focused on the procedure and the skill. So for them to have a little bit of understanding, and if they can't do it, at least have a really well-informed staff member sit down and have that patient feel like you're really considering who they are and what would be best for you, not just pushing it on them, and not just having it be an interactional, like, okay, we want you to pay this much money to get this. And then they don't have a good expectation. So if you can just even have a little bit of that other side to things, you're going to find your practice like that, because people love that. They crave it.
Yeah, well, I think over the course of time and with the advent of the rise of the internet and how
Yeah.
educated people are,
Yeah.
they come in with expectations, and obviously,
Yeah.
your ratings on Google or whatnot drive people's behavior, whether to show up to your clinic or someone else's. So it's certainly more competitive, and I think being able to go from a transactional to a
100%.
interactional relationship with the patient makes all the
Yes.
difference. In they're calling it patient experience or patient journey, and it's about patient journey and as well as outcomes, of course. But and what you're speaking to fits right into that narrative.
Yeah, exactly. Because people do very much focus on outcomes, and a lot of people pay, and insurances pay lip service to patient experience, but the reality is a lot of it's about outcomes. What I try to really impart is that it's a win-win-win for everybody if you just take that little bit of extra time, because then the patient's happy, you're happy, the insurer's happy because everything's going the way it should be. So it actually expands your practice. I mean, literally, I have people who fly to see me from Canada and Kentucky, and I have someone who comes to see me every 4 months from New Hampshire and Maine, because they just like that I listen to what they say, and I feel honored for that. Like I feel, I don't take that for granted. But it is that difference of just making them feel heard. And for people where that's not a natural skill of theirs, you can learn that skill and it will be valuable to you. And if you really feel that that's not your skill, you get someone in your office whose skill that is.
Yeah.
Get someone where they can feel like, wow, this surgical coordinator is amazing, or she really hears everything, and I feel like I can describe stuff and she'll know exactly or he, of course it could be he. But it's that really expands your practice way more than you think. So
Well, I will say that there's a lot of surgeons who have a lot of success, and you mentioned that Bausch Shalom, Alcon, Zeiss, and all these other industry people flock to you. I came from Alcon, so I can raise my hand and testify
yeah.
to that being the case. And that we should be seeing what they're doing. It leads me to my next question, that many physicians have a complicated relationship with industry, but yet innovation only happens when physicians and industry work together.
Absolutely.
How have you approached those partnerships throughout your career, and what have you learned about helping bring meaningful innovation to patient care?
Myself, I am not what I would consider an innovator, but what I'm actually really good at is saying, okay, like as an example, when they had the head of marketing come for our femto machine and spend the day with me, and what I am able to do very well is say the things that are really working well and what's also not working well. And it's clear to me, like if they just did this, or this, it would make it so much more user friendly. And part of it is not even from the clinical aspect, which of course is important, but also from the user aspect, And so for me, a lot of it is what are the results, but also what makes it, how can you put it into your practice and what makes it usable, And so, so there are some examples where theoretically something was really good, and yet in practice it wasn't really practical, or it wasn't it made it hard to use it for patients. I did tell the company, I'm like, the way you have this set up or the way this is organized, you're making it so that it makes it hard for us to use it. So that's one of the things, that kind of feedback I give to them that's helpful, I think.
Then life handed you a challenge that no amount of surgical training could prepare you for. You experienced a life-altering injury to your dominant surgical arm, something that forced you to confront questions many surgeons never want to face. Can you take us back to that moment and describe what was going through your mind emotionally, professionally, and personally?
Sure. Well, as we know, if you're a surgeon, your surgical hand is very critical. And
Hmm.
with eye surgery, you're dealing with, hundreds of a millimeter and things. And so last December, I was rushing off to work as I tend to do. I rush around a lot, and I went flying down some black ice, and I had a very severe wrist fracture. It was a displaced wrist fracture, and I needed emergency surgery, and then I needed a second surgery, and all of a sudden, I was out, and I was not able to. I mean, I could barely get dressed, let alone think about
Oh,
going to the
wow.
office. Funny thing that happened was when I was in the ER, and the orthopedist came to see me, and I'm like, okay, so do you think I can get back to work in like 2 weeks? I mean, that was just like so unrealistic. And he's like, I don't think so. So I all of a sudden, and I had patients scheduled. I mean, I do live in an area where I'm very blessed to have. I don't have to. If anything, in Rhode Island, we don't have enough doctors. So my surgical schedule was booked, like 5 months in advance. And so all of a sudden, I had all these people that I couldn't do surgery on. And I didn't know when I was going to get back. And it was a scary feeling because as one of the realizations I had is that people who break an arm or a wrist or hand, most people, it is very painful. It's very inconvenient. It, puts everything on hold for a while, but then everything heals and they go back to their lives. But for a surgeon, it's life altering. So for someone else, a wrist fracture may not be life altering, but for a surgeon, it's life altering potentially. And I think also, though, part of it also influenced me because of my age. So I was 65, going to be 66. So I also was feeling very much in the peak of what I'm doing now surgically. I was not having any intentions to retire anytime soon from
Hmm.
surgery. And as we all know now, I mean, people are so much younger. And so a lot of surgeons are operating easily till 70 if they
Hmm.
want to,
Right.
and perfectly till 70 without any sense of decline or any issues at all, and some beyond that. So at 65, I really was not thinking of retiring anytime soon or having any thoughts about that. So it was a very scary thought to think, oh my gosh, what's going to happen now? And it was a real interesting process, because also it was very, very cold. This was in Rhode Island, and I could barely, I couldn't fit my arm even into a coat, so I was walking around with ponchos
Whoa.
all the time. It was like 0 degrees, like layers of ponchos. And so I had to think, what am I going to do? So I basically, the surgery center was great, and they are willing to work with me month to month on what I would do. Like I say, okay, there's no way I'm going to be able to get back by X date. Let's move it out another month. And they were so wonderful working with me on that. But I had to go through a very deep process of like, what am I doing here? And the orthopedic surgeon wasn't even sure. He said, it'll be like at least 6 months. It could be even a year before you get back to surgery. So that was a very sort of shocking and scary thought. And so by the time it took about 3 months, and I realized I was able to go back to the office because I guess what I hadn't really realized is if you have a severe wrist fracture, it's not just the wrist, it affects your dexterity, your ability to move your fingers. And it really affected that fine dexterity, which, of course, for ophthalmology is so crucial. Before this all happened, I had already been writing my book, Timeless Vision, which was reflections or wisdom, inspiration regarding how we approach aging and how we can get excited about getting older. And a lot of those things I talked about how we view life and how we approach things influences how we age. And so, and that events can happen in your life, and don't let them define you, but rather take an event that may be, a loss, an injury, a medical diagnosis, and say, okay, this is what's happened, and now what do I do? And come up with ways to make it work within your life and still have good things within your life. So
Hmm.
all of a sudden, I was like, okay, I got to read my own book and take my own advice. So Yeah, so I did. And what I did do was what I suggest in my book was I spent a lot of time like really reflecting and saying, okay, where do I want to take this from here? And I was getting kind of discouraged because it took a long time for me to get my dexterity back. And and then what I realized about 3 months out, when I was ready to come back, I still was ready to come back to the office and ready to do things like lasers, but I still felt I wasn't comfortable doing things like that super fine dexterity that's required during cataract surgery, with just subtle movements of your finger, your hand can, are important. And then I realized that I was very fortunate that my book was taking on a life of its own, doing, podcasts like this and interviews and, pieces of mine. People were asking for essays in their papers or magazines. So I was very grateful for that. And I realized that, I think my time has come of me shifting how I'm going to be helping people. So because in terms of, I always like to have a sense of purpose, but also it's one of the things I talk about in my book. It's really important to have purpose in our lives. That's what gives us fulfillment. And if you feel like you have no purpose, you can kind of feel off kilter, or that you don't really have a destination, clarity in mind in terms of what you want to be as a person. You have a much more fulfilling life to have purpose, and it gives you a sense of fulfillment and inner peace. And so I realized that part of my purpose is I do love helping people truly. We all know that cataract surgery, you have to be perfect all the time. And the sense of perfection and a sense of weight of responsibility that comes with that. You are responsible for people's eyes. And as humans, other than our brain and thought, that one of the most important things is our vision to us. And so it's a huge responsibility that you carry as an eye surgeon. And so I realized that at this phase in my life, what I was going to do was to sort of pass the baton or pass the torch and no longer do cataract surgery. So I'm retiring from cataract surgery, which is a huge, huge decision. But I'm still in the office. I do a lot of glaucoma and dry eye. I actually still see a lot of people still want to talk to me about their cataracts and get advice about it, even if I'm not going to be the one doing the surgery. They like talking to me about it. And so I'm concentrating on sort of spreading my message of empowered aging through my book and doing things like this. But it was a very life-altering experience for sure. And it does, to this day, and this has been now 7 months. So, I still can feel the difference in my hand versus how it was before the surgery. So I think part of my decision, though, was based on where I was in my career. And so if someone were 40 years old, 50 years old, it would be different. And step away at a certain point. And I'm not completely stepping away just from that part of it, but that was like a big part of my identity. I guess that's another point, was that's who I was. I was an eye surgeon. And so, or who I am, and I still am. And it's just, I'm not doing it right this minute, but that's who I relate to, and that's who I am as a being. So all of a sudden it's that thing of like who you are and what your identity is threatened. And you have to go through a big, one of my kids pointed that out to me. They're like, "Are you going to be okay going back to the office and not being Dr. Larkin, the surgeon?" I said, "I'm going to have to be okay with it." So it's a big thing and that whole thing that doctors, when they retire, just in general, it's a huge shift for them, because all of a sudden they've had this like really important role in other people's lives and in their own lives. It's their identity. So to all of a sudden not have that it's kind of, you feel it drift a little bit.
Just to compliment what you said there, I was an athlete growing up. I played American football since the age of 8 till through college. And when my football career was over, because your life's routine, and you becomes part of who you,
Yes.
like you said, who you
Yes.
are. It's your identity. And so
Your
I can tell you, it's
identity.
obviously it's not helping people with eye surgery, but just my personal story that's similar is that when I, for the first time, wasn't playing football when I normally was it was like a sense of loss.
Yes.
You said, you're adrift. Like, what am I doing? What do I do now? I should be doing 2 days, or these things that are routine. There's no need for you anymore. You feel kind of lost, or like you said, just kind of floating. And I felt that's like a loss.
It is a loss. Like you have to almost grieve that, go through a grief process. And that's kind of the other point. It's not just a matter of you getting older that we feel those things happen. Someone who, like you said, here you are playing football and all of a sudden you're no longer doing it and you were this like football player and now you're not. So or other people don't know that about you. You know that, like you're still the football player in your head. But yeah, so it's all of a sudden, okay, what's my identity and who am I and where am I going? So it really happens at different phases of life. It's not just when you're 65, 70, 80. It's when you're 30, 40, 50.
The title itself is beautiful because it works on multiple levels. Literal vision, life vision, and purpose.
Yeah.
What is the central message you hope readers take away from Timeless Vision, and who did you write it for?
So the essential message, it's multi-layered, but really is that our whole lives, we can have a vision, and we should have a vision of who we are, where we're going, and that there's no expiration date for that. So we think of like, oh, you get to a certain point in your life and okay, that's who you are. You've been there, done that, and now you're just kind of coasting, or you're just in your routine of your life. Maybe you retire and you sort of maintain those old roles, or you maybe give them up. But it's not like you're opening or expanding. You're sort of adapting, maintaining, and maybe even declining a little bit in terms of who you are, and you're narrowing as a person. But so the idea with Timeless Vision is that you never have to narrow. It might be just shift. That it's an active choice to see forward no matter how old you are. And it was funny, I had a gentleman, one of the great things is that I've dealt with a lot of patients who are I watch people go through their lives, but also I have a number of patients who are very vibrant and peppy in their 90s now. And I had a 98-year-old gentleman come in the other day. We were talking. And he said, I feel like I really need to expand my social circle. And he was feeling
this guy's 90? You said this guy's 90.
He's 98. 98. But he's with it. I mean, it's like, he was amazing. I said, oh my goodness. I said, I am eating this up because this is what my book's all about. So at 98, he's thinking how he wants to expand his social circle.
That's very cool.
And sort of, so not that idea that, oh my God, I'm 98, forget it. You know what? I'm just going to sit around and be bored. No, he wants to talk. He says he really is missing having good conversations with people about things. And it is harder as you get older because people pass away. And I said, you know what? Even if you're 98, if you meet other people who are 90 or even 80, you'll be able to find people who you can have great conversations with. And then I talk about my friend George, who's in the book, who's been a real inspiration. And he's at 98 now. And I met him when he was in his early 90s. And I remember because I like to ski, and he was saying, I wonder if I should take up skiing again. I'm like, no, don't take up skiing again. You're 92. It's not a good time. But the point is, that's how his brain was thinking. It was like, oh, right. I like what you're doing. I want to do it too. So part of it is really having, and it doesn't mean you have to think about skiing, but you can think about maybe expanding your social circle, or there's always stuff to learn about, or there's always stuff to think about. And so to always have that feeling that it's never too late to have some sort of vision for who you want to be and what you want to be doing in your life until you literally take your last breath. Try to be your best self.
So the book challenges the traditional narrative that aging is a period of decline instead of reframes it as a period of growth, possibility, and reinvention, as you've explained. What are some of the most powerful lessons you've learned about aging that you wish people understood sooner versus waiting till their sunsetting or retirement age and, as you were saying, kind of decline?
Yeah. So I think one of the really important things, and I got this from my children, actually. My kids are around 30. I have two girls and they're around 30, and they have partners that are around 30. And they all told me that it's even at 30. So one of my big sort of thoughts about aging in general is that if you back up for a moment, that, when we're born, until we're about, toddlers, we're not thinking about aging. We're not thinking about anything. We're just experiencing life. We're just
Hmm.
soaking it all in.
Right.
And then around, preschool, on up, really, kids are just so excited about learning everything, but there are also this sense of like, wow, these people who are bigger than me, grown-ups, can do all kinds of things that I can't do, and there's so many exciting things to look forward to. So they're looking forward to getting older, to aging. They want to be older. And then it's around 18 to, 25. It's like, okay, this aging thing's going pretty fast. I think I just want to like, let's just keep it right here. Let's slow this down.
Great age.
And then 25 to 30, it's like there's those little things that start happening already. Like you can't stay up as late, you maybe can't drink as much wine as you did, or
Hmm.
you can't, you don't recover from an injury quite as quickly, where there's like, you start getting that little sense of like, that you're not 20 anymore. So it's around 30 that people start feeling that they want to resist aging. And so it starts at a very young age where we want to try to hold off aging. So if you think about that, you could live to 100, but let's conservatively say 80, 30 to 80 is 50 years of trying to resist aging. So a really important thing would be to just know that it's part of life and think of it as an exciting thing of like new windows of opportunity opening up through your life. And that also it's never too late. Now, yes, it may be too late at 40 to become, an Olympic athlete, but part of it has to do with the concept of saying it's never too late to think of new things or to grow. All right. So it may be that it might be too late for a certain type of thing, like becoming an Olympic skater, but or that's just not in the cards for you, but it's not too late to do other things. So that there's always a time you can always shift your path. And I find that what my daughter said to me was that even a lot of people they know who are in the 30s are feeling like, oh, I wish I wasn't going along this path. I'm realizing I'm not liking my work as much as I thought I would, and I wish I could go a different path. Well, you can. And it's not that it's always easy, but the fact is you can shift at different points, and that it's never too late to do that. And there's always another path that you can take. And so that's a really important thing that people think they're very locked in. And sometimes you are locked in to some degree, but it's sort of a matter of taking time to sit down, really look at what do you feel you're missing from your life, or what would you like more, and how can you maybe even make just small little changes to sort of bring that into your life. And that can be if you're 30 years old or if you're 98 years old.
Hmm.
And I think that's a really important thing, is to just always kind of not to be unsatisfied about where you are, but just to sort of be honest about where you are and say, okay, here's where I am right now. And do I want to keep going in this direction, or do I want to make a little shift, or do I want to bring something else into my life that would make me feel better about myself or about my life?
You spent your career helping people see more clearly, first
Mhm.
through surgery and now through your writing. As you look ahead to your own next chapter, what excites you most, and what advice would you leave our listeners about creating a life filled with purpose, curiosity, and timeless vision?
Well, I feel that I am living right now my experience of living what I talk about in my book. And I sort of feel like I can be an example to others, not just give them wisdom and pass a lot of information, but also be an example of what others can do. That it's not just theoretical information that I'm giving along, I'm giving you now lived experience too, that I've gone through something myself. And it doesn't have to be a book that you write, but it's an individual journey for each person, like it has to be. But I'm excited about all the next steps that are going to happen. And I feel that I'm excited. I love when people read my book and then they come to me and they are excited about feeling, in a sense, permission to sort of have that next phase of life. There's this sense of freedom that you get where you've kind of you sort of give yourself permission to just do what you want because you've already sort of, at a certain phase. And now it's kind of like the, older person that we think of who just does whatever they want and dance in the streets and wear whatever they want because who cares? They're just trying to help them, be their best selves. And they don't have to prove anything anymore.
Mhm.
So that is a little different for someone who's older because when you're 30 and 40, you still do feel that pressure of having to prove things, or you have a role as a parent or as the career you're in. So that sense of not having to prove things anymore, not that you really should have to prove anything, but you
Mhm.
have certain expectations that are beyond just yourself. They're your family and your work. But when you do get to an older phase, there is that sense of, okay, I don't have to prove anyone, and I can just be or not be certain things that I want. And so I'm very excited about that. And I've just gotten such a flood, if you will, of feedback that it makes me feel like I'm doing the right thing by helping people's mindsets about going forward in their lives. And then that makes me feel good and makes me want to continue to do that.
Mhm.
And I'm excited about that next chapter, if you will.
Mhm. Dr. Larkin, throughout this conversation, we've talked about restoring sight, finding a purpose through adversity, redefining aging, and creating a meaningful next chapter. I imagine there are members of our audience who are hearing exactly what they need to hear at this moment in time from you. For those who want to continue the conversation, learn more about your work, connect with you personally, or pick up a copy of Timeless Vision, where can they find you?
Well, the easiest thing is if you go to durgalarkinmd.com, all lowercase, DURGALARKIN, MD.com. That brings you to my website, and you'll see how you can get Timeless Vision. It also has an email that you can contact me. I'm on Facebook and Instagram. Facebook is Dr. Durga Larkin. Instagram, it's at Dr. Durga Larkin. And I'm on LinkedIn as well, Durga Larkin MD. So any of those platforms, I love to hear from readers. Any questions that you have, happy to talk with you. I love that personal interaction.
And I believe Timeless Vision, Empowered Aging Redefined is available throughout major booksellers, including Amazon.
Buy wherever your books are sold. Of course, Amazon, Barnes & Noble, but local bookstores as well. So wherever you get your books, you can get it.
Cool. And Dr. Durga, if there's one thing our audience will take away today, is that while our eyesight may change with time, our vision for what's possible in life never has to. Durga, you spent decades helping people see more clearly through your surgery, through your leadership, your teaching, and now your writing. You've shown us that some of life's greatest clarity comes not from what happens to us, but from how we choose to see it. Thanks for joining us on the Q-Switch Conversations. I enjoyed having you on today.
Well, thank you, Spence. It's been a pleasure. And I'm so happy you had me on.
Great. The Q-Switch Conversations podcast is my way of giving back to an eye care industry and community that's shaped my career, my perspective, and my passion for what we do. This platform is truly built for you, the clinicians, the innovators, and change makers redefining what's possible in our field. So if you have a fresh perspective, a unique experience, or know someone doing great things in eye care, I'd love to feature them on the show. You can hit me up on my LinkedIn or drop me a line at d.spence@meridian.ch. And as always, we'd like to thank Riverside.fm and Passionate Media for making this show happen, and Meridian Medical, the global leader in premium ophthalmic lasers, for making it all possible. That's a wrap for this episode of the Q-Switch Conversations podcast. Until next time, this is Spence, and I'm out.
You're listening to The Q-Switch with your host, Spence.